Okay, Bismillah Rahman Rahim. Thank you, Rizwan, for nice introduction. Now, today, certainly, it's a train the trainer. So, you all already are experts of your field in a way that you're not primary care physicians. But certainly, the subject where we're going to discuss is the one which you have to taught to your juniors. Certainly, it isn't a hi-fi thing. It's just a pattern of presentation, that's it. So I feel most of you will be knowing whatever we are discussing today. It's just how to present to a general practitioner which is more palatable for him to really digest and then certainly practice. That's the key philosophy behind this whole program. So I feel you won't find something new, just a pattern of how to go about and present these things to your further trainees. Firstly, I think it's very important to know that what is hypertension. Actually, in our primary care setting, it's a belief that it's a disease of number. And something beyond that is hypertension, and you have to bring that number down, that's it. If someone coming with 150, 160 by 100, your objective is to bring that number down to 140 by 80, that's it, and start a drug for that. But actually, the disease is like this. If you see the continuum of the disease, we just think hypertension is a risk factor for major cardiovascular disease. This is just a start. It progresses, causes atherosclerosis, ischemia, and this is just a cardiovascular continuum. In this fashion, it is affecting every organ system. You can correlate it with every organ like kidney, brain, eyes, everywhere. Same thing is happening. Cardiac ischemia, ventricular remodeling. Now, in our clinical setups, when people don't frequently going to the physicians, you don't know where you are picking your patient. You're picking here, you're picking here, you are picking your patient here with a high blood pressure. You don't know. So that means it is not just a disease of number. You have to assess your patient in a comprehensive fashion to assess his status. And this is just cardiovascular continuum, remember. You have to look for every organ system in this relation. That was just a background regarding hypertension, that you have to think of this disease as a risk indicator and then assess your patient comprehensively for everything in him which you expect. And let's see how to go about. This is a scenario which we people face very frequently. Just go through it and come up with your solutions for that. And that we'll discuss with everyone, that what you'll offer to this patient.